Hello and welcome. You're watching AD4 TV Radio News Update, coming to you live from Abuja, Nigeria's capital. I am Adirayo Senami. The International Monetary Fund, IMF, is granting the sum of $3.4 billion to Nigeria to support the fight against the coronavirus pandemic. The emergency financial assistance approved by the IMF is the highest so far to any member country. The grant, facilitated via the Rapid Financing Instrument, will help prevent the depletion of Nigeria's international reserves and provide financing for the country's budget, which has been affected by falling oil prices triggered by the pandemic and price wars. The IMF praised the Nigerian government's immediate response to the crisis and noted that short-term focus should be on higher health spending and palliatives for households and businesses. The confirmation that the IMF intervention is indeed a grant runs contrary to a story in our bulletin a few days ago, stating that the $3.4 billion is a loan to Nigeria. We sincerely apologize for the error. The Director General of the Nigeria Center for Disease Control, Chikwe Hekwazu, at a daily briefing of the Presidential Task Force on COVID-19, admitted that the health agency is currently struggling for bed spaces to accommodate COVID-19 patients across the country. Ehekwazi explained that the Lagos state government is currently experiencing the greatest bed space shortage, but Kano and Abuja are also facing similar challenges. The NCDC boss pointed out that 3,500 bed spaces have been identified as available for COVID-19 patients across the country, but the strategy may have to allow home care in certain circumstances if the problem persists. In another development, the Nigerian Minister of Health, Dr. Osage Hanire, during the presidential briefing on COVID-19 on Thursday, announced that 113 Nigerian health workers have tested positive for COVID-19. He said most of the infected health workers are from private hospitals and represent about 6% of the total 1,728 infected persons. He therefore condemns those who treat coronavirus patients in private clinics without taking necessary precautions or training, and warned uncertified private establishments against handling coronavirus patients. Meanwhile, the Nigeria Center for Disease Control confirmed 207 new cases of coronavirus in Nigeria, bringing the number of confirmed cases to 1,932, with 58 deaths recorded. The Minister of Youth and Sports Development in Nigeria, Sunday Dare, on Thursday directed payments of funds into accounts of Nigerian athletes to provide some relief amidst the COVID-19 pandemic. The payment was made from the 10 million naira donated by Remo Stars chairman Kunle Soname and 1 million naira from a named patriotic Nigerian as takeout for the athletes' relief fund. The sum of 50,000 naira was being paid directly into the account of each athlete from the Youth and Sports Ministry's Central Bank account. The minister had floated a relief fund for the athletes whose earnings have ceased since the suspension of all major sporting events in the world as a result of the coronavirus pandemic. A lawmaker representing Nasarawa Central at the Nasarawa State House of Assembly in Nigeria, Suleiman Adamu, has died. He passed away in the late hours of Thursday after a brief illness at the Federal Medical Center, Kefi. The Speaker of the House, Ibrahim Balarabe Abdullahi, described the lawmaker's death as an act of God, while asking his family, constituency, and the entire Nasarawa state to pray for his soul. The deceased is to be buried on Friday in Lafia. He is survived by a wife and 5 children. We'll take a short break, but when we return, Russia records nearly 8,000 new coronavirus infections in just 24 hours. Stay tuned, details coming shortly.
Mental health and the COVID-19. It is no longer news that the coronavirus disease is now a pandemic. New cases are on the rise and the death rates have increased. People may develop issues of poor sleep, poor eating habits, undue irritability, and uncertainty. Some may also start to cope with the use of alcohol, substances of abuse, and self-harm. While all of these reactions can occur in response to a stressful event, it is important to share tips to help people remain in optimal mental health. 1. Let's normalize the conversation. If you feel anxious or afraid about the virus, remember, you are not alone. 2. Don't self-diagnose. Just because you have symptoms that are alike to COVID-19 doesn't mean you have it. 3. Plug out and limit sources of information to credible ones. 4. Develop a healthy daily routine, especially as quarantine is ongoing. 5. Focus on the things you have control over. 6. Practice social distancing, not social isolation. Utilize online channels to keep in touch with friends, family, and loved ones. 7. Avoid maladaptive coping techniques such as drinking and smoking excessively or self-harm. 8. Educate children, the elderly, and loved ones on social distancing, quarantine, and how to keep safe. 9. Take care of yourself by eating healthy and sleeping well. 10. Create time for self-development via reading and online webinars. 11. If you or anyone you know has a physical or mental health problem, please use your medications and encourage them to do same. 12. Reach out, seek help, and get help should the need arise for your health. Remember that there is no health without mental health.
Welcome back and moving into a global news update. Russia hits its biggest single-day jump in coronavirus cases as it reports 7,933 new infections today, bringing the national total to 114,431 with 1,169 deaths. According to the country's coronavirus response headquarters, 13,220 patients have so far recovered. The spike comes a day after Russian Prime Minister Mikhail Mishustin appeared on state television informing President Vladimir Putin by video conference that he had also tested positive for the virus. The International Monetary Fund (IMF) on Thursday approved loans worth hundreds of millions of dollars for Mali and Ethiopia to fight the coronavirus pandemic. The IMF board granted $411 million to Ethiopia from its rapid financing instrument, which allows nations to bypass the lengthy negotiations needed to secure a full economic assistance program. Mali will also receive $200 million to help plug the deficit created by government spending to cushion the impact of COVID-19. Meanwhile, the first train carrying stranded Indian migrant workers home set out today as the country prepares to lift its nationwide lockdown. The restrictions, which have been in place since the 25th of March, are set to ease on Sunday. Railways, which had been suspended during the lockdown, resumed service for one train this morning, taking 1,200 migrant workers from southern Telangana back to their home state of Jharkhand in eastern India. The Director General of the Railway Protection Force said this is a pilot program that will test out social distancing measures based on which more trains will be deployed to take migrants home. He added that workers will be screened and a decision on whether to institutionally quarantine or not will be taken upon arrival. Still on the pandemic, Prime Minister Muhyiddin Yassin has announced that Malaysia will allow most businesses to reopen on Monday as part of the country's strategic approach to reopen economic activities nationwide in a controlled and careful manner. A nationwide movement control order was put in place by the government in March, prohibiting Malaysians from traveling abroad. It also banned social, religious, and educational gatherings. Under the loosened restrictions, most businesses that involve close physical contact, like movie theaters, nightclubs, and Ramadan bazaars, will remain closed. Restaurants will be allowed to reopen, but must enforce social distancing. The Department of Health in Navajo Nation and American Indian Territory on Thursday said it has recorded 164 new cases of coronavirus and 9 related deaths, bringing the nation's total to 2,141 cases and 71 deaths. Navajo Territory spans 3 states, New Mexico, Arizona, and Utah, with cases recorded in all 3. The nation is, however, set to implement a 57-hour weekend curfew, which will go into effect on Friday at 8 p.m. local time. Under the curfew, all residents will be required to stay at home, except for essential workers. Naval Police will also set up checkpoints on roads and issue citations for those who break the curfew. And that's it on 84 TV Radio News Update, coming to you live from Abuja, Nigeria's capital. You can join the conversation on our website at www.84tvradio.com. Please follow us on our social media platforms at 84TV Radio on Facebook, Twitter, LinkedIn and Instagram. Please subscribe to our YouTube channel at 84TV Radio. Many thanks for watching. I am Adirayo Senami.